I would like to invite Dr. Sakal Talam to present his case on ASD tips and tricks.
What is it? Presentation 1. Right here. Respected chairpersons, expert panelists, and learned audience, Assalamu alaikum. I am Dr. Mohammad Shakawat Alam, going to present on transcatheter closure of the second term ASD tips and tricks. There has been a remarkable improvement in the treatment strategy of the second term atrial septal defect over the last few decades. With the improvement in device technology and procedural techniques, transcatheter closure of atrial septal defect is nowadays accepted as the treatment of choice. Recent generation device with biocompatible materials enable easy and safe deployment with the properties of flexibility, recapturability, and repositioning. So, use of improved device design and refined equipment finishing promotes reendothelialization and reduces the potential damage to the nearby structure. In addition to improvement of device properties and performance, there has been a distinct improvement in the procedural technique from numerous experience of device closure of the ASD. So, ostium secondum is the most commonest septal defect among the other septal defect. So, how to assess that second term ASD for device closure? By transthoracic echocardiography for the both pediatric patient and thin-billed adult patient, and transesophageal echography for the adult and obese child, and sometimes with the intracardiac echocardiography for the adult, but it is not available in Bangladesh. So what is the role of echo to assess the defect? Identify the septal defect is present, defect type, number of the defect, measurement of the size of the defect and available range, and coexisting congenital cardiac abnormalities, assessment of the hemodynamic effect, assessment of the transcatheter ASD device positioning during the procedure, and assessing the post-transcatheter intervention like embolization, residual shunt, positioning of this other structure, etc. So, reams are very important for deployment of the second term closure of the second term ASD. What are the reams needs to be consideration? Atrioventricular valve reams or mitral ream, and IVC ream or SBC ream, posterior ream including posterior superior or posterior inferior, retroaortic or aortic ream, superior and inferior ream, and coronary sinus ream. These are the images of retroaortic ream. This is the retroaortic ream, and this is the SBC ream. This one is SBC and this one is IVC ream. This is a posterior ream, this is a mitral ream, and this is coronary sinus ream. So, who are the acceptable device candidate? More than one device absence, probably no, if it is very important ream. Retroaortic ream absence, yes, it can be acceptable for device candidate. Posterior ream absence, probably no, but it depends on the size of the defect because it enhances the migration risk of the device. Inferior ream absence depend on the extent and coronary sinus. And superior ream absence, yes, it is acceptable, but in exception of true sinus venosus and partial anomalous venous return. For the atriomitral valve ream or absence of mitral ream depends on overall extent and proximity of the device to the mitral leaflet. or tricuspid leaflet. So before going to the device closure for secondary ASD, we have to understand the device structure. There is two discs, LE disc and RA disc, and between these two discs there is a waist. Actual size of the defect or size of the device should be based on this waist of the devices. Usually RA disc is smaller than the LE disc. So what are the other ways for sizing of the defect? There is angiographic, balloon angiography can be done, or for the floppy rims, stop flow technique also can be done. So this is the device with left disc and LE disc and RA disc. In between these two discs is the waist and with the delivery cable. What are the available devices are there should be known, because this is Amplatzer. It is started from the 4 to 40. These are the other Sera rims and Sera devices or Oculotech Figula Flex. These are also 4 to size are also 4 to 40, but customized size are also available. So for the device selection, device size selection, device without balloon sizing 2 mm greater than the largest size of the transesophageal echocardiography size. Waist 1 to 2 mm greater than the sizing balloon diameter in stop flow diameter of the device defect of the septal defect. Waist 1 to 2 mm greater than the size of the largest size of the measured on color by the transesophageal echocardiography. But in case of ring absence, or it has to be taken 2 to 4 mm more than the size of the actual defect. And LA must be able to accommodate the device. So interictal septum should be lower, not lower than the LA disc. Is the patient suitable for device closure? What are the criteria are there? Usually ASD secondum should be, diameter should be less than 34 mm, and rims except aortic rim should be, better it would be 7 mm, but at least should be 5 mm, and dimension of the septal length not smaller than the LA disc of the chosen device. And what are the poor anatomic candidate? Absence of significant posterior rim, mitral rim or IVC rim defect, because it increases the risk of device migration. So what are the common approaches for the interarterial septal defect closure? That is a pulmonary venous technique, left pulmonary upper vein or right upper pulmonary vein, or LA rope technique, or wire assisted, dilator assisted or balloon assisted technique, or snare assisted technique. If it is multiple ASD is there, so multiple ASD technique also there. It should be smaller, one should be closed first, and there is some other technique also is there on some center, like transthoracic echocardiography technique also without angiography. So here is one standard approach for simple ASD closure. One 37 years old man with large ASD secondum. We have taken 24 ASD device, but it fall down, and then we upsize our size to 28, and we have successfully deployed this device. And
Dr. Alam, your time is over. Please,
sir,
we finish. Please finish your presentation. Your time is over. The slide is not showing. Please finish your presentation. Dr. Sakhaut, you are not audible and your slides are not also showing.
So in conclusion, the size of the defect and adequacy of the rims and stability of the septum define the limit of the AHD device closure. Standard approach for the both simple or difficult cases help in successful transcatheter closure of the AHD secondum. Thank you so much.
Thank you, Dr. Sakhar Dalun, for your very informative information. I think students are getting very benefited from this presentation.